Thank you for tuning in to The Reality Pill. My name is Dr. Ben Talei. Joining us today for a very important reality pill, we have Dr. Claudie Marie Elizabeth Bolduc. So Dr. Claudie, we'll call her. She's an amazing physician and public health advocate. Originally from, I'd say, a combination of USA and Canada. Was in Montreal, which is where we had met back in the day, and now is hanging out on the phone with us to tell us all about coronavirus, COVID-19, to figure out what's real, what's not, because we've been hearing so much in the media, and this is the one time in our recent history where the spam and viral mail is worse than the virus itself. So we've seen a lot of things going wrong that aren't real. We don't know what to take as real or what to be afraid of, what not to be afraid of. We have the president who likes to speak very quickly and prematurely about things, and then we've got Fauci by his side trying to correct things, and everything gets a little confused for everybody, on top of the fact that they're putting out fake videos of tanks and videos about blow dryers, fake messages from people and doctors from other countries. Claudie herself knows all about this stuff. She has a page called Pulse Check MD, which helps everybody, especially during this coronavirus panic, to really see what's real. And she guides you to the real resources, figuring out, stop listening to your friend's text message that they sent you of a voice who's South African, of a lady talking about her friend in Spanish, but it's a virus from China. We're going to go through all the things we can to help people understand what's actually going on in the US, what's been going around the world, and what the real prevalence is of the virus and things you want to worry about. And she's an emergency care physician, and so she cares a lot about emergencies. And this is like her forte. So she is, as much as people say, on the front lines. She's got to go every single day and put her face in everybody else's face. And while we are treating something that we know is not the worst virus the world has ever seen, but it's an extremely nasty one. Very, very nasty, fickle little virus and how it reacts. Let's just start with the basics. If you could explain to us what coronavirus is, just quickly, and what is a virus?
Okay. Thanks for the long introduction, and thanks for doing this. I think it's really important to break the misinformation. So let's start with the basics. A virus. Basically, there's two kind of germs or bugs, this is simplifying, that attack our systems. One is bacteria. Bacteria are little creatures that invade. Some are good, some are bad, and we use antibiotics to kill the bad ones. That's the simplified version. Viruses are different. Viruses are kind of all around all the time, on countertops. During flu season, there's more viruses around, and they're just little pieces of DNA, so they're not even an organism in and of itself, that when they get into your system, kind of hijack your cell and start making multiple copies of themselves using the machinery of your own cell. That's a virus in a nutshell.
So it's not alive.
It's not. Scientists classify it somewhere between alive and not alive. It's a mystery.
It's a mystery what it is. So it's something that goes into your cell and makes your cell start replicating it.
Correct.
And make all the proteins at once, and then that's what your body starts reacting to.
Correct.
Okay, so the coronavirus is a nasty one because it's got lots of little fingers on it.
Mm-hmm. It looks like it has a crown.
Yeah, and that's what those pictures are. So those things they grab on, and it allows it to insert itself very quickly into a lot of cells, into cells in your nasal airway, your nasopharynx, and down into your lungs very quickly. Because of that, it's very easily transmitted, and it jumps from one person to 20 people in a matter of no time, and it can do so from either coughing, and you're within a couple feet of that person before it falls down, or they talk very wet even, or just being
those wet talkers.
Yeah, you're exposed to anything moist coming out of their body, which can be anything, really.
Correct.
So that's how people get it. That's why it's easy to get. Once you get this, you don't know how it's going to react on anybody's body. So some people, I think the bottom line I want to know from you is, are younger people at more risk, less risk? Are older people at more risk or less risk?
So we're still learning so much about the virus, but what we know right now is that there is kind of an age-related response, and that older people seem to be affected more severely than younger people. Older people are more likely to die from the virus. Older people are more likely to have severe illness requiring ICU admissions than younger people. But that being said, 18 to 44-year-olds, 1 in 5 of them that get the virus are still going to need to be hospitalized. So 20% of younger people still get severe disease.
So when we're explaining this to people, for young people who think they're invincible, number one, even if you're young and you're not going to die from this, you're being extremely stupid and selfish by not doing what everybody else is doing right now because you're the one who's spreading the virus. The other is that the population statistic has nothing to do with the individual. So
Correct.
you as a person getting it my age, your age, you're younger and lovelier than I am, but like, yeah, like you could be super healthy for a minute. You could be the one in the 40 or however many that actually does get pretty substantial illness from it. So you don't know that. And during that time, you don't know if you can get sick or get someone else sick. So we rely now on people isolating or getting tested. And then what's actually the reality of testing right now?
So we don't have enough tests. It doesn't really matter what the government is saying. We don't have enough tests. So the reality is we have to prioritize who we test. And what's important to test is people that are coming in really, really sick. They need ICU level care. They need to be hospitalized. They need oxygen. We need to know what we're dealing with. Is this someone who has a regular pneumonia and needs antibiotics, or is this someone that has COVID-19? So those people, it's important to get a test right now. So they're the priority and they're the people we're testing. All the people at home who have fever and cough, and they might have flu, they might have some other virus, they might have COVID-19. We don't have tests for all of them, and it doesn't make a difference. They should just be staying home and isolating and not spreading their germs, whatever that germ is. We just don't have tests for them right now.
And with this kind of test, I mean, how comfortable do you feel testing someone one time and knowing that they don't have it or that they're just not going to go get it the next day?
Exactly. Sometimes the tests are positive one day and negative the next day in the same individual, and positive the third day, and so on. So tests are not perfect in and of themselves. And secondly, all the people who feel fine right now at home that are saying, let me order one of those $200 at-home kits and I'm going to test myself for the hell of it. How fun. Oh, great, I'm negative. Well, maybe next week you'll get COVID-19. Are you going to buy a test next week or the next week or the week after that? I mean, if you feel fine, there's no real reason to test right now.
Yeah, so people are trying to use testing for a million different reasons. Ultimately, if it becomes more accurate, it would be great. But right now we're basing treatments based upon people that need it. What patients I've talked to or friends I've talked to don't understand is that this is a virus. It's not a bacteria. There's no antibiotic that goes and kills it. We're either looking forward towards a vaccine, again, on a mutating virus that can change, or an actual medication that treats it to get rid of either the symptoms or the load of the virus, which both of them are important because you can treat someone for their symptoms, meaning they're having trouble in the lungs or things like that, so you can give them steroids or an actual cure. So is there an actual curative treatment that decreases the viral load?
So right now there is no curative treatment. Again, doesn't really matter what the government is saying or promising. We have no curative treatment. There are promising treatments that are in clinical trials right now as we speak in the US, in hospitals that I work at, and hospitals all across the US, but there is no proven cure. And there's a lot more damage that can be done by jumping on to some medication that may have some promise, because all medications have side effects. And, until we test something and we test if it works, we don't actually know if it causes harm. Maybe patients on it do worse. We don't know until we do the research.
And what if I come to you and I say, well, I don't care, I want to take the risk, give me the medication?
As a physician, I would not prescribe something that it's not indicated for. So chloroquine, for example, everyone wants chloroquine or chloroquine plus azithromycin. Well, those two medications together can cause something called long QT, can cause essentially your heart to stop.
So you said that when we were chatting about it, maybe like 5-6 days ago. So we were talking about QT prolongation. And then 2 days ago came out a big article about somebody, I think it was in Arizona, husband and wife, who got a fish tank chemical cleaner called chloroquine, which is essentially the same as the medication, but probably not, predictable dosage. And they took it, and what happened to them?
I think one died within a couple of hours. That was the husband, and the wife ended up in the ICU. I don't know how she's doing.
Yeah, and I think both were related to heart issues. Most likely. Yeah, so when we look at these things, people very haphazardly say research shows. The good thing is we have research in this world that's helpful, but for every helpful bit of research, or actually useful bit of research, we've had probably 9 out of 10 useless bits of research that were proven wrong. Or not just useless, but it ultimately got you to finding the solution for something, but they were incorrect until that point. Research does not mean proven evidence or fact.
Exactly.
Research, it just means someone's looking into it. They're investigating it. So a research article that says we treated 40 patients, which is an extremely small sample size, and says, well, 6 of them died, we didn't use it, and the other ones that we didn't include in the treatment protocol. That's not research that's conclusive. It doesn't tell you what the outcome is or what to expect from these things. It just tells you we looked into a small part of it. We think this is what's going on. So specifically, I think for hydrochloroquine and azithromycin, you know better than I do, but it seems like that study was very flawed. And it's a nice thing to have. We're happy they started it.
Yeah. And it wasn't a study in their defense. So this came out of, I believe it came out of France, but it wasn't a study. It was, hey, look what we've observed. Maybe we should study this. But it wasn't, here's a study that we've done. It was very, very, very premature. It was done in a handful of patients, which even comparing the group that got the medications and the group that didn't, one group was average age 35 years old, one was 55 years old. So there's a huge difference altogether. The ones that did worse were the older group. So you can see how maybe the medications have nothing to do with that. And then the outcome wasn't even who lives and who dies or who gets better. It's who had a positive or negative viral swab in their nose. So it's way too early to base anything on that.
And normally we don't have to have this discussion. In the normal world, there's hundreds of research test processes going on before a medication is released. The public never knows about it.
Exactly.
And let's say it were just, someone tests a medication with a shitty little, research study like this and releases the medication, the world would be dead by now. Everybody would be dead. We would have all been dead from taking a medication that wasn't proven. So usually we go through these tests and protocols and then it comes out. Right now, the difference is that the whole world is in panic mode, including the president, and wants to calm everybody down. So they want to give them hope.
Right. And
they try to give them hopeful, like, hey, no, we're not going to die. There's going to be a cure for this. It's so fast and they already have a vaccine that's going to be out next week. That calms people down, and then a week goes by and there's no vaccine, obviously. Any doctor is shocked when they hear that kind of stuff. But we're in a point right now where everybody's dying for a cure. They're so desperate for a cure. People want to please you by telling you there's one so you don't panic. And that's realistically what's happening right now. Fortunately, we have Dr. Fauci who's up there saying, no. no. no.
Take a step back, breathe, everybody.
Because it's not a cure. This is one of the medications we are investigating. And again, it doesn't mean it's not going to ultimately be a solution for us. It might be. We just don't know.
Right.
And
Absolutely.
It also doesn't mean that somehow it's going to become safe. It's never going to become safe. Hydrochloroquine is a medication that plenty of people take on a daily basis, but they are all monitored. And there are major problems that can come from it, even if they prove that it works for coronavirus. So I'm mainly perseverating about this so my friends stop texting me for prescriptions that will potentially kill them when they maybe had nothing or a cold.
Right.
Yeah, I'd ask them not to. And azithromycin is not harmless either. Everybody gives a Z-Pack like sprinkling some vitamins on something. No, a Z-Pack can also give you major problems in your gut, throw off your flora, change your body forever. So I'd say be very careful with that. Zinc, go ahead and take some zinc.
Sure.
Zinc is fine. Just don't put it up your nose because you can get loss of smell from that. So with everybody panicking, I think a lot of the U.S. health system was prematurely getting overloaded. But I think that's slowing down now. Do you have less panicky people coming in?
We actually do. I feel like social media movement, the stay-at-home movement that most people have seen, I think is working. I don't know if it's that or just people are too scared to leave their houses or too scared to go to the hospital where the coronavirus is lurking. But honestly, on the West Coast, I mean, I'm not speaking about New York, but we're in this waiting pattern. We're waiting for the tidal wave to hit the door, and the hospitals have never run better. We've made capacity. We've moved out patients that don't need to be there. We've canceled elective surgeries. There's less patients that we're seeing per day, and we're moving patients more quickly between the hospital, their beds, and then back home if they need to go. So things are running smoothly now, but we're in preparation. And we're bracing, we're waiting for, we're seeing what's going on in New York, and we're hoping that we did enough to, flatten the curve so we don't have that happen here, because it would be a disaster.
And New York is a different animal. So hopefully we'll never get to the point that New York is in. New York today, I think they were up to almost 40,000 cases, which is half of the cases in the entire US and more than other countries combined. So for everybody that thinks, the US is immune to this, definitely don't assume that. The US right now we have more than anybody, which is, if you look at, the World Health Organization, everybody's putting it out. We have more than anybody at this point. We don't have as many deaths as Italy and, those places, which is nice. But I think today alone in Italy, like 1,000 people were declared to die yesterday.
Yeah, it was 9 something.
Yeah, which, again, could happen during a war or during other things, but we're just at the very beginning of a viral spread that we just learned about back in like November, December starting. It's a very rapid spread. So what we're seeing here is the ICUs and everything else, they're running out of masks and that kind of stuff, but we're not fully overrun yet, but they're preparing. And we do expect that next week is going to be bigger than this week.
And the week after that?
We hope that at some point the virus will mellow itself out, regardless of what happens with medications, but we don't know that. Okay, so that's environmental changes, temperature changes, seasonal changes that we see with the flu, that every virus or every bacteria lives in an optimal temperature. And if you change the temperature of the environment a little bit, it might change, but we don't know that. So right now, everybody's preparing. In New York, they are getting into shit show mode, which LA hasn't seen yet. Okay?
Yes, yet. The Mercy arrived today to help out, but
yeah, the USS Mercy came from San Diego, and it's parked out here. It has 1,000 beds or something, which is bigger than any hospital currently in LA. That's wonderful to have them there. LA, I think in general, it seems like they're behaving, and we're not as risky of a population as New York. Places like that really need to behave even more than we do. And places like Sweden and things, like Stockholm, I was talking to my friend right now, they're not even they still have restaurants open.
Yeah.
This whole shutdown is not going to work unless everybody's doing it. Whether or not you think it was the right decision to make, we're all in it. It's not going to end until everybody does it, or magically the virus goes away, or we get
a vaccine.
a nice vaccine or a cure, exactly. And then we have to get the vaccine to half the population of the world, which is like 3 billion people. So that's going to be very difficult.
No big deal.
How's it going for healthcare workers' safety?
I don't think that's optimal right now. Everyone's seen the reports out of New York that they're having to reuse masks. These masks are supposed to be thrown out after every single patient encounter. Right now, we are wearing the same mask for the whole day. And in anticipation of where things are going, a lot of hospitals have started actually reusing masks. So they put them in a little Ziploc, put the date on them, and then they put them aside for 72 hours and kind of cycle through their 3 masks. So they haven't touched one mask for 72 hours. None of these things have ever been done, studied. We don't know. These healthcare workers could be putting themselves at increased risk. And if healthcare workers start to become the patients, I mean, who's going to treat anybody?
So it seems like using a condom twice. It would
Exactly.
Kind of risky.
Just put it aside, let it dry out.
Yeah, you're taking a risk. And there are now other people trying to make masks, and we don't know which mask is going to stop it for public use. Everybody says, the N95 is what most people use. But N95 masks, like my whole supply for my office was like 10 masks. They cost like $3, $4, $5 a piece or something. And they're not largely available for everybody, and certainly not in the hospital setting where you have to wear masks and goggles and everything to prevent mucosal absorption of this.
Right. And N95s aren't necessary for the to prevent the transmission in general. So this is droplets that are being passed on from patients. So it's about 6 feet apart, and they're big particles that fall to the ground. The N95s are needed for healthcare workers that are going to be doing things like putting their head this close to the patient's head while blowing air into the patient while trying to put a tube down their throat. That's who the N95s are necessary for, because that creates aerosol particles. It's not necessary for, the average person walking around the streets to be wearing an N95 at all.
Yeah, so the people in the streets, if you want to wear a mask, you can wear a mask, and the benefit of that only really is not that you're not going to catch something, you can. It's that if you're going to cough, your cough might not go into someone's face. That's like the only thing, really.
Exactly.
Yeah, but your mask itself, outside, you can touch it, you can get the virus on it, and it would live probably as long as it does on cardboard or paper, which is 24 hours, a little bit over that.
Right.
Realistically. So the N95 mask is important for healthcare workers that are in your face. Right now, there's a huge I'd say a lot of reports coming in from ENTs, ophthalmologists who are dying from this because they're getting a large viral load at once, meaning they're getting exposed to bodily fluids or aerosols from someone's body very, very close up, and they get a large hit of the virus at once. We don't know if that's what's happening, but either way, that's what's happening. And we tell everybody else, stop overusing masks. And
Please.
yeah, if you're going to use it, just to not cough on people, you can use anything and cover your face with that. I have friends who pull up their shirt, and that's great. I mean, you're not going to cough on somebody. Do that when you have a flu. Do that when you have a cold. It's a very nice thing to do. Don't get everybody else sick. Getting into the dispelling the myth portion of this. If you get a message from somebody telling you a million things about the virus, or a video that looks very well done, and your friend texted it to you, don't listen to it. It's stupid ass shit. It is viral spam, and people who are making these intentionally, I think the government said in certain countries they're going to criminally investigate very seriously. Either way, for now, don't listen to those. If you want real advice as to what it is, you can look at Claudie's Pulse Check MD, or go on any government website, and they're all being updated real time. So why listen to your friend's dumb text? I guarantee you, your friend texting you this doesn't know anything that the rest of the world already doesn't know. The first thing that I've seen over and over again is, does swallowing a lot help and somehow clear the virus from your airway into your stomach?
No, that has not been proven. That's a myth. Once the virus enters, it enters your nasal passages or your oropharynx. I mean, it's not just kind of hanging out there and waiting for you to swallow and push it into your stomach. It goes right into your cells. It starts that process right away. It's not something that, if you swallow every millisecond, it'll never have a chance and you're going to push it into your stomach. I mean, that is just theoretical and makes no sense.
And it's a shit theory. It's a shit theory that I can tell you is completely incorrect. I was trained in ENT before I did facial plastics. It is a shit theory. It's not even a plausible theory. So swallowing a lot does not ever have a chance of proving itself to be a real way of preventing any virus. So the virus will latch on immediately, and you're screwed immediately. So
you're not screwed.
Well, either way, it'll do its thing whether you swallow or not. What about citrus? I heard that if you drink lemon water, people think that the acid content will either kill the virus because somehow it spreads everywhere inside your nasal cavity, or that vitamin C pills and things like that prevent illness.
Also myth. The lemon water, same thing. The virus is already in your cells, so swallowing lemon water, creating acidity, is not going to change anything on that level. If you're talking about the vitamin C, so vitamin C has been studied very extensively in critical care medicine, and I'm sure people have heard of very, very sick people in the ICUs getting vitamin C infusions through their IVs. So that's been studied really extensively since 2017, and as of now, it has never shown a benefit in and of itself, uniquely, just the vitamin C. Some physicians think, there's no harm, so might as well do it, and so just in the sense that you need all your nutrition to have a fighting chance in the ICU, it's part of therapy, but it is not something that is routinely used and ever has shown any benefit. For the person not critically ill, not eating for 3 weeks in the ICU, there is no benefit of vitamin C in the Western world as long as you have a normal, healthy diet. We get our vitamin C's every day from citrus, from everything that we consume that is healthy. We are not deficient. So vitamin C is one of the vitamins you pee out. Any extra you take in, you are going to pee out. And if for some reason someone takes huge loads of vitamin C, it can actually cause harm. It can create kidney stones. It increases your urinary oxalate and can cause kidney stones.
And so what is vitamin C actually good for?
So vitamin C is still an antioxidant. Vitamin C is something that your body uses in the beauty industry. I'm sure you talk about this sometimes, but vitamin C is used for collagen production, and so it is something that your body uses, but we're not sitting around daily deficient of vitamin C.
Right.
I guarantee you're getting enough.
And going through med school and residency and training and everything, the one thing that we read that vitamin C is useful for is collagen cross-linking. We have never read in any of these chapters anywhere in a medical textbook that is largely published that vitamin C is good for the immune system.
Right.
Vitamin C has probably very little to do with the immune system. So why does everybody think that vitamin C is useful? This came from our grandparents and our great-grandparents. Okay.
Correct.
Our grandparents and our great-grandparents never invented anything to keep us from getting sick. So why would we think that this myth that's been going on for so many years is correct? Just because it's been around for a long time, it's never prevented anything.
Right.
People who take vitamin C as a supplement still get sick. People who take Airborne, well, they got sued. Airborne got sued for false claims. So Vitamin C has very little to do with your immune system that we know of. Doesn't mean they don't still test it, they don't still try it, and there are still things that they combine it with. But in general, there are 1,000 other things more beneficial for you than vitamin C when we're looking at like immune function.
Correct.
What about heat?
Heat. So,
Well, what's your body's normal temperature?
So a fever is at 38. Most people are going to hang out at Celsius. I'm Canadian, sorry. So most people are going to hang out around 36.5 to 37.5, and you're in very normal range.
So 98 degrees, 99 degrees, 97, late 97s, like that range. 97,
sure.
99 degrees.
In American.
In American, that's your range of normal temperatures. But they're saying that 80-degree weather will kill this. So what's your take?
So that's bull. So that's a myth. So essentially what we know will kill it on surfaces are things like UV light, but what will kill it on a surface is not what will kill it in your body. These are two completely different things, and that's what people are completely missing the point when they're sticking hair dryers up their nose. I mean, you can cause serious damage, you can burn yourself, you can do really bad things, and you are doing absolutely nothing to kill the virus.
Yeah, so I saw a video that my friend sent. It's a doctor who made a very convincing video with digital graphics, and there's like the coronavirus, and then it's a doctor saying it. So he said heat has been proven to kill viruses for years. That's why our body gets a fever. You can go sit in a sauna and breathe in the air and kill the virus, or you can blow dry up your nose and kill the virus. This is from a doctor. This is what you call a quack. Okay, this is a doctor who got a degree somehow in something, I don't know what, came out with a book in 1984 about heat killing viruses. Now, if this book really had a solution, this guy would have been well known by now. And
right.
so did this. It didn't just get overlooked, and all of a sudden, 30 years later, the guy comes up with a new invention. So heat can kill a virus. You can desiccate, meaning you can dry out a virus and kill it with heat if a virus is on a surface, and you heat it to the point of killing it. To get to the point where it's going to kill the virus in your body, you'd have to kill your body. You'd have to kill your cells. Same with a fever. A fever gets up to a 104 is like a normal fever. 105 becomes a malignant fever. Anything above that, you're killing your body. So you cannot get to any temperature range that's not going to kill your cells, but kill the viral cells. The virus is stronger than you when it comes to heat. Just realize that.
Exactly. And the only thing that this is important for in terms of, yes, heat, environmental heat can kill viruses on surfaces. That's just important for the possible seasonality of all this. So if as we heat up, there's not going to be as much transmission because it doesn't linger on surfaces and hands, and when people are touching their faces as much, there may be less transmission in summer months, but this has no application to inside your body.
And that's probably what the president is hoping for when he says, and then this will all go away, and this will all. So he's probably, somebody mentioned that to him, and he took that as a definitive reality as opposed to a possibility.
Right.
It is possible that during summer months, viral outbreak dies down strictly because it is not an optimal temperature for it to live in. Okay, It doesn't mean it's not going to live. It's just less of them get past, less of them survive for longer periods of time. So it takes the overall prevalence of it down, just as it does with a common cold and flu. So that's what we're hoping for. But there are viruses that make it through that. So you're saying on surfaces, the virus can be killed. Is it easy or is it difficult?
It is so easy to kill a virus on a surface. Any household cleaner will do it. This is kind of a weak little virus.
It doesn't have an outer shell, doesn't have all these spores and weird shit bacteria.
Well, it has what we call an envelope, but that's actually what makes it even a little bit weaker in this case. It does not have spores, it doesn't leave spores, but it does have an envelope that actually makes it weaker. And so it's lipid soluble. And so you can essentially take any household cleaner, wipe down your counter properly the way, we've been saying, wash your hands. I mean, there's no magic. You don't need to put your hands under UV light or burn them with a hairdryer. You just need to wash them and the virus is gone.
Yeah, so the virus is easy to kill on surfaces, which is nice to hear because everybody thinks it's not, but it just passes very easily on surfaces too. So you gotta kill it. So Lysol will work. UV light, how does that work?
So I don't know the actual mechanism behind it, but I can tell you that it works by making sure you don't miss a corner, when you're wiping things. So when we have a patient that has COVID-19 in the hospital, for example, and then they get moved out of that room and we're going to put another patient in there, when we want to make sure every little corner of the room is cleaned, is virus-free, we actually do use UV light. That's how hospitals will clean.
Nice. How do you deal yourself with Dr. Google? Because I think Google is an amazing resource for people to learn things. However, at this point, they're assuming harmful things. How do you approach
Yeah.
them to try to explain to them without running them through everything you learned?
Yeah.
I'm
So
having trouble with this, other than just telling them to, if it's my friends, I go, dude, shut up. I go, just trust me. You don't know anything. But you can't say that to somebody you don't know. You have to tell
right.
them in a very nice way. How do you say it?
I think just letting them know, that there's a lot of misinformation out there and you can't trust all the media headlines and things that people are putting together, unfortunately saying, this is coming out of the Stanford so-and-so. I mean, there's just too much misinformation out there. So what I tell people is I say, here's what we do know, here's what's science, here's what's proven, and the resources you should be using are actually quite limited in terms of the CDC, NIH, World Health Organization, public health departments. These are the people that have actual information that is useful to use, or if you're not sure, ask your physician. But Dr. Google is just not something that can be used in this type of situation.
When we're trying to run away from this virus, can you explain the difference between aerosolization of a virus versus just droplet transmission?
Yeah, this is so important for people to understand is this isn't some magical virus that you should be afraid to leave your house and it's going to be lingering in the air and you can't go for a run. This is a virus that gets passed by droplets. Literally, if I took this water bottle and I sprayed it, what comes out of there, those are little droplets. It's only going to go so far. It's going to hit the ground. Then it's on the ground too. If I touch it and touch my face, okay, I can get it in my mouth. Or if you were standing right in front of me when I did that, within 6 feet, you might have got a droplet in your mouth and you might get infected. So as long as you're staying 6 feet away from people, and if you touch surfaces, you're washing your hands before you touch your mouth, you're not going to get this. There are ways that you can prevent it. Aerosol is different. Aerosol is the way that things like measles or tuberculosis are spread, and that's the nasty stuff. That is the stuff that's a lot more worrisome because, someone sneezes in an auditorium in the corner and basically everyone in the room can get it. It's a very different transmission process than droplets. This is not what we think coronavirus is doing. The only time that coronavirus can be aerosolized is if I took this and I put it in a spray can. You can see how I can make this water into an aerosol. It's different. It's a different process. That doesn't happen day to day.
In hospitals, it can become aerosolized.
In hospitals, it can become aerosolized.
Yeah, so weird things like that. But yeah, when you look at the infectious capabilities of this virus versus measles and those things that are aerosolized, they're much higher with the aerosolized particles. This one is one that you have to either touch and then touch your face, or somebody has to cough. It doesn't linger in the air for 10, 20 minutes. It floats, and then it slowly starts to go to the ground. And they measured that about 6 feet distance by the time it hits the ground before it hits somebody else, unless some kind of weird gust of wind is coming and picking it up. We're talking about rooms with, I think, no wind or air in them.
Right.
So the other question a lot of people were asking is the symptoms of this are vague. Everybody comes in, oh my God, I have a sore throat, runny nose, like things that you would have more likely as a cold. With this, we've been seeing a lot of dry cough, fevers, in general, malaise, feeling terrible, like you have a flu, like really, really bad. Part of what was being spread around with misinformation is that everybody gets pneumonia from it and fibrosis. They say that the lung just starts to fibrose within a couple of hours, which is physically impossible. So what's happening when people have to go on these respirators? Pneumonitis, pneumonia, what's actually happening?
Yeah, so basically, just to reiterate, the symptoms are most of the time fever, cough, the feeling of shortness of breath, and just really malaise, myalgia, as your whole body is just feels like it's beaten up. We are actually seeing quite a few people have GI symptoms with this as well, and that's actually increasing. We're seeing more and more diarrhea. Now, as soon as I put that out on my Instagram, all of a sudden I got all these messages saying, my boyfriend has diarrhea, do you think he has COVID? No, food poisoning still exists and you might have diarrhea for 24 hours and it's not necessarily COVID. But I just want to put it out there, we are seeing some people with more GI symptoms as well.
What's the most common cause of chest tightness or shortness of breath?
Anxiety.
And
diarrhea.
And diarrhea. But we both know that it's anxiety.
Right.
It's a commonly known thing that most people that show up to you with shortness of breath or chest tightness or something like that, it's typically anxiety, and that's what anxiety feels like.
Yeah, it's a real feeling, and it's not a doctor being dismissive when they talk to you about maybe this is anxiety. It's a real feeling. You will feel tightness in your chest and shortness of breath with anxiety, but it's not dangerous and it will pass.
Yeah, if you think that your brain and the chemicals in your brain and the chemicals in the rest of your body are unrelated you are very, very wrong. So I've had patients who I try to explain to them what anxious or nervous healing is, and they think, again, I'm being dismissive. It's a real thing. So you
Yeah,
have real
absolutely.
changes happening in your body, whether or not you think they're real or not. They're actual changes that happen that don't happen in people who are either on sedatives all the time or calm in general. So before I cut you off, you're saying what happens to the lungs that you're actually...
Yeah, so back to this fibrosis fear mongering thing that's out there. So essentially in about 5% of people, there will be severe disease. So what happens is actually, not to get too technical, but what we're seeing is the first week or two, your body's actually reacting to the virus itself. And so that is fevers, that is your body's kind of innate immune system attacking the virus. And that's why you feel shitty. That's why you feel full body myalgias. And that's why you're feeling the cough, trying to get it out, and fevers. But then what happens is, as your body kind of starts to maybe win the war against the virus a little bit, in a subset of people, you're having kind of an overreaction of the immune system, and you're getting this overwhelming inflammatory response. You're getting this what we call a cytokine storm, and it's leading in a very small percentage of people to something called ARDS, acute respiratory distress syndrome, which is a very severe process that happens in the lungs, one that is not new, one that critical care units
It's very
know how
commonly
to
known
treat.
with SARS and MERS. And
Absolutely. It's known with flu. It happens with flu. And so it's just happening at a slightly higher rate than flu, and it's a little bit more unpredictable as to who it's going to happen in. And these are the people that are getting intubated and are getting admitted to critical care units, and they're being treated for this ARDS. In any patient, not just for COVID, in any patient in which you're going to have a prolonged course in the ICU, a prolonged intubation, so for weeks on a ventilator, you're going to get inflammatory changes in your lungs, and that can lead to fibrosis in the long term. We are not in the long term by any means for anybody that's gone through COVID. And so for us to pretend to know that there is going to be lifelong changes in these people's lungs and they will never be the same, how can we say that when this literally appeared in December?
so you're saying that those voice messages from that South African lady about the
She's lying to you.
But okay, so just because they used the medical word fibrosis, it doesn't mean that it's actually real or that could actually physically happen in that time.
Correct.
Okay. What do you think about, so we were all thinking about, well, is isolation or sequestering or doing all this stuff, is it the way to go, or do you let it wash through the population? What's the problem with this specific virus that's different than flu that's been around for years? What's the difference with this one and having it wash through the population? What do you think would happen if it happened at the rate that it's happening at?
Yeah, so flu spreads to the population. One person gives it to about 1.3 people. Right now, what we're seeing with this is that one person gives it to about 2.5 people. That's too rapid of a spread. We've never seen this virus before, so nobody has antibodies, nobody has kind of a defense to it. So it's easier to spread from person to person than when the virus every so often encounters a person that's immune to it, which is what happens with the flu, or someone that's been vaccinated against it. And so it's going to go too fast. And what the other side of it is, there is a slightly higher death rate. We don't know what that death rate is yet, and I don't think it's the high numbers that we're hearing by any means, and we don't need to go into that. But there is a higher death rate than the flu, and there's a higher complication rate. So if we spread it really fast throughout the population, and we have all these people needing ventilators at the same time, the hospitals can't keep up, and you're going to see really high death rates. And that's what's happening in northern Italy right now. And that's what we can't have happen in the US. That's why we're saying we need to do this sequestration. We need to do isolation. I don't have the answers more than someone like Dr. Anthony Fauci has, or any of the specialists out there. But if we look at what did work in the world and how China got through this and how South Korea got through this, they had to do complete shutdown of the country. And it's not for, let's shut down 13 out of 50 states kind of haphazardly for a week. That's not what they did. They did a complete shutdown for 7 weeks, 8 weeks to get it under control. And then you can have a slight return to some normalcy with better monitoring of the cases if you have testing and whatnot. But if we just do this haphazard approach where, some states do it, then some states don't, and we kind of just do mitigation so you can kind of sort of still go out and congregate in groups. I mean, what you're actually going to do is just keep it at this unsustainable level for a longer period of time versus just shutting it off to begin with, taking the hit and then getting on with it.
Yeah. So as of now, we don't know a way of getting rid of the virus. We don't think we'll get rid of the virus. But what we do know is, as Bill Gates said in his 2015 TED Talk, we aren't ready for it. And it's hitting us too fast. And the whole world is going to become overwhelmed if it hits too fast. So fortunately, there are people who have started slowing it down so we don't get overwhelmed. Because once we're overwhelmed, that's when the chaos would happen. So
Exactly.
and I'm not talking about like National Guard chaos. I'm talking about people not being able to receive regular medical health care that they need for other diseases that are not this, plus people who need help for this with ventilators. I've had people ask, well, oh, my country's not doing it. We're fine. I'm like, well, your country is Sweden, Netherlands. They're getting exposed to it a couple weeks later, just
They're
like
not there
we
yet.
did. We just went through this whole thing. Look at our statistics. We had 0 cases reported when Trump started opening his mouth. Now we have 90,000. It hasn't been that long.
And you have to remember, we're testing like 10% of people that got it. I mean, I'm throwing that number out there. We don't know what it is, but there are a lot more people out there that have it than 90,000.
Yeah. So I advise people in other countries, you can implore your local politicians to hurry up, or you guys just start doing it yourselves. I was somebody when this virus came out, I didn't know much about it. I was against it. I said, you know what? The harm it's going to do compared to shutting down economy and shutting down all this is going to be equal or less. Now, the way I look at it, no, it would present a humongous effect of a natural disaster. Imagine if the whole world had a giant earthquake all at once. Like, you're not going to be able to handle the fallout from that. And so that's really what became more clear for me as I saw the behavior of the virus and how you have random people getting super ill from it.
Right.
So I am definitely scared of this thing, and I don't think it's the worst in the world. There's definitely worse viruses we've had, but it's a nasty little bug, and the way it's spread is impractical right now. Like, we're not going to practically be able to handle it. Do you think COVID-19 is dangerous for those with asthma?
We know that it is. So it is more dangerous for people with asthma than for people without asthma. People with asthma have more reactive airways, and so the inflammatory process that I was talking about seems to be hitting them a little bit harder. And another reason that we've seen it be a little more dangerous in patients with asthma is logistical reasons. We're trying not to use things like nebulizers or treatments that we would normally apply to every asthmatic patient that came in. We're trying not to do that, to not aerosolize COVID, because we don't have protective equipment. So as you can see, there's problems in treating patients that come in that have asthma that are having a hard time breathing because of everything that's going on in terms of protective equipment.
Yeah. And people always wonder about the death rate of this. We don't really know right now what it is. It seems in the US it is substantially lower because we're testing more, maybe, compared to when you're looking at like the Italy statistics. But I'd say we don't really know.
Anyone who thinks they know the death rate to this is the same type of guy who's telling you they know exactly what the stock market's going to do from day to day. It's impossible to know what the death rate is here because we don't have the data. The smartest epidemiological minds out there actually think that it's going to be closer to 0.6 to 1% death rate.
That's what I've heard.
Yeah, and that's based on multiple different things, extrapolating based on what we're seeing and how many cases we're testing. But it's based largely on the South Korea data, because even though we've now surpassed them in amount of tests, we haven't surpassed them in amount of tests per million population. They actually tested very, very widely, very, very quickly. And so they got a much better sample of the general population than we did, but they still probably under-tested the mild cases. And the death rate they saw was 0.6%.
Okay. The last main question, people worry about getting reinfected. I have not read anything about 1,000,000 different mutations or 1,000 different mutations being found in lab tests that they're doing. Do you think that people are getting reinfected with it when they say that they get the symptoms coming back after they're cleared? Is it reinoculation with the same virus that they just never built immunity to, which would be weird? Or is it the same virus just lingering around in them? What do you think?
Yeah, so if this is acting like any virus that we've known to be similar to coronavirus or other viruses before, once you've had it, once you've cleared it, you've created antibodies to it, you can't get reinfected with it. Unless it mutates, and we can get into that after, but you can't get reinfected with it. The cases that we've seen in China and Japan where people cleared it and then got it again, there's a few things. So as I mentioned before, the test can be negative and positive on sequential days in the same patient. And so the fact that they had one negative test and it was cleared and then later had a positive test, that could be a problem with testing. And that's most likely a patient that has never completely cleared the virus from their system. And there is no reason for us to believe at this time that the virus is A, mutating, or B, that people are getting reinfected with the same virus.
Yeah, for it to mutate and cause that kind of thing, you have to mutate very effectively, very quickly, and also do so in a way that doesn't make it ineffective, because you can mutate a virus in a way that's going to be better for
Right.
you. I don't think mutation, it's too early for things to mutate, but you never know. We might encounter a virus like that in our lifetimes.
Knock on wood.
At this point, it doesn't seem like it. You think we missed any big myths about the virus or anything that people really need to understand?
Not that I can think of. I don't know if you see any more questions up there.
No, I've seen, hopefully the other countries that go under lockdown will see how the other countries reacted. Like the US, there's no need for an emergent panic where they're not shutting down resources. They're not trying to kill you. They're trying to catch you from the virus. So the markets stay open. Everything else stays open unless we see that it's harmful, which I don't think that'll ever get to that point. All right, so don't be scared about toilet paper or food or those kind of things, which is insane. That's all for us. Claudie, thank you so much. If you guys want to follow her to really see, I'm talking about the real facts of what's going on with the coronavirus situation. In the future, I'm sure she's going to continue blogging about other medications and health problems. You can follow her on Pulse Check MD. Otherwise, she will probably be on TV screens soon on different news channels. She will be a very, very treasured part of the medical community, especially if she continues to advocate for public health. Thanks, Claudie.
Thanks, Ben. Thanks, everyone.
See you soon.
Bye.